This is Dr. Dorwit, and this is a recording of the narration of the slides for Lab 5, the bones of the lower extremity, starting with slide 21. This slide lists the bones that we are going to be studying in this section. The os coxa, which is the hip bone, also called the coxal bone, C-O-X-A-L, the femur, the patella, the tibia, the fibula, the tarsals, the metatarsals, and the phalanges. The os coxa is formed by the fusion of three bones: the ilium, the ischium, and the pubis. In the embryo, these are three separate bones. In the adult, these bones have fused into one bone called the os coxa. This is an anterior view of the os coxa, or coxal bone. We can see the iliac crest. This was the landmark that I discussed when I was defining crest. It's the landmark that you're touching when you put your hands on your hips. Just inferior to the iliac crest is the iliac fossa. On the anterior end of the iliac crest is the anterior superior iliac spine. Now I know that that's a mouthful, but really is a good name because it tells you exactly where it is. Inferior to the anterior superior iliac spine is the anterior inferior iliac spine. And located in the midline, joining the os coxae to each other, is the pubic symphysis. On the posterior surface of the os coxa, superiorly, it was the posterior superior iliac spine. We see that at the posterior end of the iliac crest. And inferior to that is the greater sciatic notch. The sciatic nerve passes through the greater sciatic notch. Inferior to the greater sciatic notch is the ischial spine. And inferior to the ischial spine is the lesser sciatic notch. The sciatic notches got their name because the sciatic nerve goes through them. On the medial surface of the os coxa is the auricular surface. This is the surface that forms a joint with the sacrum. The big hole in the os coxa is called the obturator foramen. The place where the femur fits into the os coxa to make the hip joint is called the acetabulum. The part of the os coxa that you sit on is called the ischial tuberosity. Here is the femur. The femur has a head and a neck that are classic for the definition of head and neck. There's two large blunt projections that are called trochanters. They're the only trochanters in the body. They're the greater trochanter, which is lateral, and the lesser trochanter, which is medial. This is the posterior surface of the femur. Proximally, we see the gluteal tuberosity, which is the insertion for gluteal muscles. We also see the linea aspera. At the distal end are the two condyles that form a joint with the tibia. There's the medial condyle and the lateral condyle. There is a tiny bump just above each condyle, the medial epicondyle and the lateral epicondyle. And just superior to the medial epicondyle is a tiny bump called the adductor tubercle. This is the insertion point for the adductor muscles, which are the muscles of the inner thigh. The tibia and fibula are the bones of the leg. The leg is the region between the knee and the ankle. Proximally, within the knee joint, are the medial and lateral condyles of the tibia. Just inferior to the condyles is the tibial tuberosity. The tibial tuberosity is the insertion for the quadriceps muscles. On the anterior surface of the tibia is the anterior crest, also called the anterior border. In plain English, this is the shin. On the distal end of the tibia is the medial malleolus. This is the bump on the inside of the ankle. The more narrow bone in the leg is called the fibula. The bump that's on the outside of the ankle is part of the fibula and is called the lateral malleolus. The proximal end of the fibula is the head of the fibula. Be careful with the spelling of tibia and fibula. They are similar, and I would like you to be able to get all the credit you can get on the quizzes and practical, so please take care in the spelling. The metatarsals are the bones of the foot that correspond to the metacarpals, which are the bones of the hand. Carpus means wrist. Tarsus means ankle. This is another case where you need to be very careful with the spelling. The bones of the toes are called phalanges. The big toe has 2 phalanges, and the other toes have 3 phalanges each. The bones of the ankle and foot. Continued. These are ankle bones. The talus is the bone that forms a joint with the tibia. All of a person's weight is loaded onto the talus. The heel bone is called the calcaneus. Distal to the talus and on the medial side is the navicular. Distal to the navicular are the cuneiform bones, cuneiform like the form of Babylonian writing. There's the medial or first cuneiform, the second or intermediate cuneiform, and the third or lateral cuneiform. The bone that is distal to the calcaneus on the lateral side is the cuboid. This is a name that very accurately describes the appearance of the bone. There is a mnemonic for the bones of the ankle, but the bones of the ankle are considerably less complicated than the bones of the wrist, and I usually don't use the mnemonic. The last topic in the lower extremity is the comparison of the female and the male pelvis. Pelvis is the plural for pelvis. The female pelvis is shorter and wider. The male pelvis is taller and narrower. The female pelvis is lighter weight. It has less mass than the male pelvis, which is heavier. And the female pelvis has a wider pubic arch, about 80 to 90 degrees, whereas the male pelvis has a narrower pubic arch, about 50 to 60 degrees. Most of the other differences that you'll find on the table in the lab manual are related to the fact that the female pelvis is wider than the male pelvis. The acetabula are further apart because the pelvis is wider in the female. The inlet is oval, and in male, the inlet is heart-shaped. And this also is related to the fact that the female pelvis is wider. In this slide, we see the wider oval pelvic brim of the female pelvis, and we also see the more narrow, heart-shaped pelvic brim of the male pelvis. And if we look in a lateral view, we see that in the female pelvis, the sacrum tilts in less because it's making more room for the baby's head. In the male, the sacrum tilts in more. This is the conclusion of Lab 5, the bones of the appendicular skeleton.